I'm Aakash Shah. I'm an orthopedic surgeon at Kansas City Joint Replacement and Sports Medicine Center. I decided to go into medicine right out the gate knowing I wanted to do orthopedic surgery. It's the one field in medicine where patients are hurt and you can get them back to their level of activity. With other disciplines, they're very important, but sometimes patients can't tell if their blood pressure or cholesterol levels are improved. But our patients can tell when their arm, shoulder, knee starts to feel better. And I find that very gratifying. The most common procedures I perform are arthroscopic rotator cuff repairs, ACL reconstruction, meniscal tear repairs or debridements, chondral resurfacing, reshaping cartilage, regrowing cartilage. In the shoulder, I commonly perform rotator cuff repairs, bicep tendon repairs. We also do total shoulder replacement and reverse total shoulder replacement. I take care of fractures on both the upper and lower extremity, whether they're sports injuries or they're injuries from weekend warriors. A lot of us get hurt in the yard or working around the house. There's both athletes and people just being active that can get hurt, and we're happy to take care of them. Well, first and foremost, I believe the best approach to take care of a patient is if they're your own family member or a friend. If you keep that in mind, I think you'll have the best path of treatment for patients. Often, non-operative treatment is very successful, and it's just as gratifying as operative treatment for me. I think also understanding where a patient's household and work situation is, so balancing that out, because sometimes we have to balance life with an acute injury. My patient care approach is to look at the whole patient, and what I mean by that is there are both operative and non-operative treatments. There are times when operative treatment is the best solution for that patient. However, there are also times when non-operative treatment is the best solution for that patient. I think we have to take into account the patient's health status, where they are in life, what their pre-injury activity level is and was, what their goals are moving forward. What does their job situation look like? What are their responsibilities within the household and outside the household? So there's a lot to consider, and I think if we look at each person individually, we get to the best solution for that person. Well, some of the honors and achievements I've had, I would say first off, are a reflection of the team that we've had around us. I've had the privilege of serving as the president of the medical staff here at Menorah Medical Center. I've served as the chairman of the board of trustees here at Menorah Medical Center. I currently serve as the NBA Combine physician for the Miami Heat. Done that for over a decade now, and I currently serve as the medical director for the NFL Player Benefits.